Chairman of the Barbados Diabetes Foundation, Mr. Ron Davis, President of the Barbados Association of Retired Persons, fondly called BARP, Mrs. Marlene Rice-Bowen, CEO of the Barbados Diabetes Foundation, Mr. Kelly Boyer, other directors of the Barbados Diabetes Foundation, Dame Billy, Vice President of BARP, other directors of BARP, invited guests, members of the press, good morning. Thank you very much for joining us on this Zoom platform, as well as those viewing on YouTube. It is my distinct pleasure to welcome you to this virtual signing ceremony, and I thank you for joining us. This is a very significant occasion for both organizations for several reasons. First, the renewal of this agreement, the first signing of which goes back several years, underscores the sustainability of the relationship between our two organizations. It represents a meeting of minds, or I should say a coming together of two organizations that had a common purpose: the health and well-being of persons in Barbados, particularly older persons. The services provided by the Barbados Diabetes Association to BARP members has been, and we are sure will continue to be, invaluable and most welcome. I know that this new agreement will further strengthen and enhance our relationship. The second notable feature of today's virtual signing is that it is being done today, October 1st, 2021, which has been designated as the International Day of Older Persons. And the theme for this year is digital equity for all ages. BARP will join with the UN and other agencies to adopt a person-centered human rights approach to ensuring digital equity, including adequate policies, access, digital literacy, and safety for individuals of all ages. This focus on digital equity affirms the need for access and meaningful participation in the digital world by older persons. It will seek to bring awareness of the importance of digital inclusion of older persons, tackling stereotypes, prejudices, and discrimination associated with the digitalization, taking into account social norms and the right to autonomy. This all supports BARP's current focus on digital competencies for seniors. Earlier this year, we had several webinars that were fully subscribed. And just this week, we hosted a virtual consultation with the Republican Status Transition Advisory Committee for our members. And so I can assure you that BARP is working assiduously to ensure digital competency for seniors. And hence this morning, we chose to sign this agreement virtually. And actually another feature making this virtual signing significant is that this is the decade, this 2020 to 2030 is the decade of healthy aging. And this takes on, as you would agree, even greater significance with the pandemic having a disproportionate effect on seniors. So during this decade, I can assure you that BARP will join efforts locally and internationally to ensure that it is a decade of concerted, catalytic, and sustained collaborations on healthy aging. So the signing of this agreement between the Barbados Diabetes Foundation and BARP is one such collaboration, in that it puts into full focus, and intentionally so by both organizations, two issues that concern older persons significantly: NCDs, and in this case, diabetes, and digital access. So this collaboration this morning in the form of a virtual signing is a very tangible demonstration of inclusion in the digital arena while addressing healthy aging. It will literally add life to our years. So thank you very much for joining us. And now I wish to invite Mr. Ron Davis, the chairman of the Barbados Diabetes Foundation, to address you.
That everybody can hear me.
Yes.
Thank you. Our internet is a little bit sporadic, so I hope everybody can hear me and that we're not going to drop off. But protocols already haven't been established. I want to welcome everyone here today, especially my friends at BARP. And I have to say at the outset that having sat on the board of BARP and now on the board of the Barbados Diabetes Foundation, I know that the members of both boards are committed to the ideals of both of these organizations in moving it forward and creating experiences for both of our members within the gamut of our society. This agreement that we are signing this morning is more a renewal of an agreement that was signed a year ago, I believe, or 2 years ago, and we have been able to benefit from it from a financial perspective in the services that we offer to members of BARP, and the members of BARP have been able to benefit from it through the discounts that we have offered through the agreement. And so I think it has worked for both parties to the benefit of the members of BARP especially. And we would like to see it continue to grow from strength to strength as we move forward. We do have some new services that are going to be coming on stream that we will talk about. Maybe Mr. Boyer will give us a little update on those and give you a preview of what's coming. And so we hope that we'll be able to offer those services at discounted prices to the members of BARP as well. So I'm not gonna say very much more, but I have to say that we are very, very excited about renewing this agreement and keeping the proposal between us going from strength to strength as we move forward. Thank you very much.
Thank you very much, Mr. Davis. And I'll now invite Mrs. Marlene Rice-Bowen to offer some remarks as well.
Good morning, all protocols observed. I would want to start on a sad note and use this space to extend to the grieving relatives of those who have lost loved ones to COVID, or profound condolences from the Board of Directors, management, and staff of BARP. We will uphold you in our prayers, and we do hope that their memory be a blessing. Today, October 1st, the spotlight is directed towards the older persons in society worldwide. We recognize their contributions as shapers of society, and simultaneously we seek to ensure that their human rights and privileges are upheld. World statistics have revealed that by the year 2050, the global population of the age 60 and over is projected to reach nearly 2.1 billion. Therefore, all planning must include this age group, as they will constitute a large sector as consumers. Today, we celebrate the International Day for Older Persons under the theme, Digital Equity for All. The access to digital platforms is still not readily available to all ages. However, it's work in progress. BARP, we are committed to ensure that all members have the training and the access to the digital platforms. And in the first quarter of 2022, we will introduce IT for everyday use. And we will all, because we have observed the dearth which currently exists, and through programs, we will fill that void for our seniors. We will also, in the first quarter of 2022, open a members business center. That center will give members who do not have an access to the computers at home to come to BARP and complete their passport applications, submit their income tax forms, renew driver's license, etc. Whatever they need access to a computer, those persons who do not have a computer will be able to access a computer free of cost because you are a member of BARP, and that is part of our service. We will also provide hands-on training with the ATM machines and border controls, and some of these persons, because COVID is here, but we are going to get through this. We are going to get through this. And once we do, then people will travel again. So somebody might need to print a boarding pass, but you don't have a computer at home, you don't have a printer at home. Once you're a member of BARP, you can access our members business center and print that form. Wherever the need for digital access is needed, BARP will provide through training and access. We are committed to ensure that no member is left behind. Today, as our executive manager alluded to earlier, we decided to demonstrate through action digital equity for all ages by signing this agreement digitally. And of course, it was new and persons were wondering if it will work, but we were confident that it will. And we decided to not only in the area of digital access, but also we are indeed in the peak of a pandemic. So we are trying to keep our movements, as close as possible. We do view this partnership with the Barbados Diabetes Foundation as pivotal as they seek to offer medical support and other requisite services to members of BARP who are indeed diabetics. Members of BARP, supporters of BARP, and seniors in Barbados. Whereas we applaud the Diabetes Foundation for extending the offer to our members, we need people to execute our programs. We can plan exhaustively, but our implementation will be stunted if the human element is missing from the equation. And I say that because we are in the peak of a COVID pandemic. Every bulletin, the songs of the sirens in the streets, every death, everything has affected us. Tears will not erase the situation. Get vaccinated. Tears will not wash away COVID. Observe the protocols. Residents in Barbados, I want you to view your health responsibility as synonymous with your civic responsibility. And as I said earlier, observe the protocols. There are those of you who are sitting on the fence. Your time has expired. Get vaccinated today. Tomorrow isn't guaranteed. COVID is real. Today, I reiterate my call to institute your own personal lockdown. Gradually reduce your days away from home. Stay inside and slow down the spread of COVID. Children are on holiday, so there's no need for everybody to be on the streets. So if right now you are going out, say 4 days a week, reduce it to 3, and then reduce it to 2. And then you'll find you'll just go 1 day a week. But we must do our part to slow down the spread of COVID. We at BARP fully support a period of prayer for our country and will provide the digital access to our members once the dates and times are shared nationally. I conclude by supporting the provision of digital platforms, training, and when financially possible, the sourcing of equipment for older persons. Today, we applaud all older persons, and we acknowledge with profound gratitude the offer extended by the Barbados Diabetes Foundation to all members of BARP, particularly those who are not sufferers. We don't want to use the word sufferers. Those persons who are indeed diabetics or who are close to being diabetic. We want to reduce the incidence of NCDs in this country. And the Barbados Diabetes Foundation, they have extended this service to us, and we have embraced it because we need healthy people. We need persons who are aware of their status so that they can take better care. So today, as we celebrate the older persons, as we celebrate under the theme of digital equity for all, I end by advising of not begging, but advising all Barbadians, all residents of Barbados, please stay safe. We will continue to support you, but you have the responsibility. Your health responsibility is in your hands. Again, thank you to the Barbados Diabetes Foundation, and we do look forward to strengthening this critical relationship that we have started.
Thank you, Mrs. Marlene Rice-Bowen. And we will now have the simultaneous signing of the agreement. We're signing here at BARP, and the Diabetes Foundation is going to be signing as well. And you'll see both on screen signing simultaneously.
So you want to see me on screen signing?
Yes, yes.
Unfortunately, that's not going to be possible, so I have it there.
Yeah, okay.
Right.
Tell me where you're ready, Ron.
Right, we are seeing
trying
both.
to get the TV working.
Yeah.
Yes. There are both signing at this point the agreement for the provision of services, and this is a renewal of a previous agreement that worked very well between our two organizations. Thank you very much. If the press has any questions, they could use this opportunity to ask any questions at this point. And following our questions, Mr. Cali Boyer, the Chief Executive Officer of the Barbados Diabetes Foundation, will make the closing remarks. But at this point, we'll take a couple of questions from the press. You can raise your hand electronically and we will acknowledge you. Marlene, you can unmute yourself and ask.
Yes.
Thank you.
Hi, yes, please. Marlon Martin, Barbados Today. I want to find out for how long will this agreement be valid? And could BARP give us an idea what the membership, could you say how long the agreement will be valid for? And if you could give us an idea what the membership is like now, and if someone from the Diabetes Foundation could say what the numbers or the figures are looking like now in Barbados among adults and children when it comes to diabetes. Some latest survey we have done, or up to 2019, 2020 perhaps.
Okay, thank you very much, Marlon. With reference to the terms of the agreement, it is a 2-year agreement, and our membership at BARP stands today as 22,000 persons.
Financial.
So 22,000 financial members.
Yeah,
With regards to the question for number of people with diabetes, I'm really glad you asked that because it emphasizes the need and the building of this relationship. Let me go back to the latest Health of the Nation study. I hope everyone is hearing this. In the latest Health of the Nation study, it shows that 20%, as much as 20% of the Barbados population is living with diabetes. So let's assume we have 280,000 people. We are talking nearly 60,000, in excess of 60,000 people in Barbados with diabetes. The scary thing about diabetes, and I'm getting passionate here because of action with the Barbados Diabetes Foundation. Diabetes affects just about every part of the body, especially the extremities. So we have a lot of people going blind, in excess of 300 amputations a year as a result diabetes. These are people losing their feet. And so to be able to join forces with BARP, because we offer this wide range of care and services. The Barbados Diabetes Foundation is the owner and operator of the Maria Holder Diabetes Center. This is a specialist center that offers a multidisciplinary care. So we provide, specialist consultation. We provide nutrition services. As I mentioned, there was 300 amputations a year. So we provide podiatry services to ensure or to do what best we can to avoid you losing your feet. And we also do eye care. We have an ophthalmology department, a retinal department that do evaluations and photography of the eyes. So it is important that we continue to build relationships with all of Barbados. And so the opportunity to extend our services and work with BARP is really gratifying and very helpful. So I hope that gives you some idea of what we do and the impact of diabetes in Barbados and the reason for our thanks to BARP for working with BARP to make sure that we get to a much older cross-section of Barbados to extend our care and services.
Thank you, Callie. Callie, could you repeat some of those statistics that you shared earlier? I think Marlon and Akil had a bit of a difficulty hearing some of the statistics that you mentioned earlier, particularly when you talked about the proportion of the Barbadian population who might be affected by diabetes.
Right, and this is not just coming from the Barbados Diabetes Foundation. This is a National Health of the Nation study, and I think there's another one that's on the way. And at that time, there was 20% of the population affected by diabetes, and we estimate that is going to be somewhere between 60 and 70,000 people living on this island. There were in excess of 300 amputations, people losing their feet. And each year. So it just shows the need for the relationship with an organ. We can use this relationship to extend the care, the multidisciplinary care in terms of podiatry, taking care of your feet, in terms of retinal screening, And so we are very appreciative of this opportunity to continue working with the members of BARP so that we can extend these services to a broad base of patients.
Thank you, Kelly. I think Marlon had another question. Marlon, you can go ahead with your question.
Yes. I wanted to follow up as well. Ms. Bowen, when she started, she offered condolence to the families of those who are grieving. Given that a lot of these deaths that we are hearing about, they're talking about comorbidities, and we suspect that diabetes might be among that. And given what you guys are doing today, what is it that's needed at this time? I don't know if the message is getting through to Barbadians over the years about, you know, taking responsibility for the health. But I'm sure you have some concern given the number of deaths that we are seeing and the age group that it's mostly affecting.
Thank you, Marlon. With reference to the age group, now the age group, as Dr. CMO was saying, it's now widespread. But what is common, what the common thread that's running through all the deaths is the fact that most persons have had comorbidities. And I think that as we seek to, and I'm talking, referring to the nation, as we seek to educate, to build awareness, let's say to raise awareness around about COVID, and we speak to the protocols, and we speak to the fact that persons ought to be vaccinated. We also have to, and maybe the Barbados Diabetes Foundation can join in this, we need then to reshape our messages as well to those persons with comorbidities. Because of course, if you have comorbidities, and we're talking about the high blood pressure, the diabetes, etc., you're predisposed to COVID, will treat you, will not be kind to you. So if, and you would, I've noticed from the reports that most persons who have passed did have comorbidities and they were unvaccinated. So therefore the message now has to be reshaped so that we reach those persons with comorbidities and encourage them to get vaccinated as a matter of urgency.
Any other questions?
Yes, a final one from me. Could we hear from the Diabetes Foundation as it relates to where do we strike that balance? We're talking a lot about COVID, but why are we not spending more time discussing NCDs in general?
Ron, I think you may be muted.
Yes, I have Dwight Edgell, who is our manager, who will answer that question for you. Dwight?
Yeah, good morning to all. That question that you raised, I think is now a bit on the back burner because of COVID. But what I can assure you is that prior to the COVID pandemic, the Ministry of Health, in conjunction with several NGOs, as you may know, the Heart and Stroke, Cancer Society, and ourselves, and the Diabetes Association, our partner in the diabetes fight, we have been extolling the needs for control of NCDs at that time. And we are still doing it within the scope of our operations. As you would know, we cannot get the press that we would like in COVID time, but I assure you that the fight still continues by all of our NGOs to deal with the respective NCDs that we service. So yes, the fight is still on. It is possibly, as I said, on the radar at this time. I hope that answers your question.
Marlon, can I just add something here as well? Not only Marlon, to the press. Over the next few weeks, BARP will be conducting telephone wellness checks on our members. We recognize that it is a huge undertaking, but we also recognize that we have seniors who live alone, And therefore, we are going to conduct these wellness checks to see how persons are doing. And if necessary, and they do need medical assistance or whatever, we will get the necessary, we'll pass that information on to the authorities. So we are committed to assisting our members, particularly in these times of COVID.
Also, if we could, at this time, I would like Dwight to talk a little bit about 2 new services that we are launching shortly, which will be of great assistance to all members of the public, and especially members of BARP, who we all know that as we get older and we start to age, everything starts to go wrong. And so our BARP members are the first in line to start to suffer from all of these comorbidities that we talk about and the NCD. So if I could ask Dwight just to mention 2 new services that are coming on stream shortly.
Yeah, good morning again. Thank you, Mr. Chairman. In the past couple of months, leading up to COVID actually, the foundation made a concerted effort to be even more effective in dealing with the NCD of diabetes mellitus, or the diabetes condition that is predominantly in our Barbadian society. And one of the things we looked at is that we give a lot of services here, which are more reactionary services. That is, as you know, as you're diagnosed, we offer care and direction in terms of managing your condition. But we have taken the big plunge in getting some of our donors to give and allowing us to purchase machinery that can have a bigger effect on the diabetes landscape. Now, the main areas that affect Barbadians with diabetes is with the extremities, as the CEO said, and primarily the eyes and with the feet. And to that end, the foundation has gone about its our charter as a charity, and we've asked and we've received donations that have allowed us to invest in 2 pieces of equipment that will now give us early detection of problems both in the feet and in the eyes. Now, we intend to roll this out as a national program in conjunction with BARP. We have already given Madam President some advice about this, but we have not as yet fully prepared our proposal, and hence I am just giving you the framework. The framework basically is that we are offering to all diabetics in Barbados the ability to come and have their eyes done at a nominal fee that will just allow us the sustainability of the program, and similarly for the feet. Too many Barbadians who are diabetic and otherwise, or who live with diabetes, I should say, and are otherwise suffering with hypertension, etc., do not know the damages that are going on with their feet. As our former chairman, Dr. Oscar Jordan said, diabetes is an insidious disease. It takes its time to destroy the body. And what we're doing, we are trying to give everyone that early detection, because early detection can cause early repair and prevention, so to speak. As in the weeks to come, Mr. Boye and our chairman possibly will have another conference like this where we can officially launch these programs. We do expect several other NGOs to come online. And let me say this, the Barbadian Health Service now is under tremendous pressure. And we as an NGO, we find it even more necessary now to step up to the plate to assist the polyclinics and all those other places where our elderly now are fighting for services because of the COVID pandemic. And these 2 programs we are doing is ensure our promise to assist however we can to improve our lot. So you can stand by for further developments in this. And we hope one program should be out as early, maybe as early December, whereas the other program, which is the vascular program with the feet, should be out in the early year. So thank you.
Thank you, Dwight. If there are any further questions, we will take one more question. All right, well, thank you very much for attending our virtual session. Before I ask Mr. Caliboye to share some closing remarks with us, Madam President wishes to say a quick word.
Yes, thank you very much, Kim. I just want to share with all that today, October 1st, as I stated earlier, is the International Day for Older Persons. But today, October 1st, is also the commencement of Breast Cancer Awareness Month. Thus, I'm wearing pink today, my pink scarf. So as you go through the month of October, let's also remember breast cancer awareness and encourage the females around you and even some males to go and get their breast checked, because we need to save lives. So it's diabetes, it's COVID, it's breast cancer, but yet we are celebrating the seniors in society. So continue to build awareness. And as I would end now by saying, I thank you very much for the task to say thanks. It's not mine, but that of the CEO of the Barbados Diabetes Foundation, Mr. Caliboye.
Yeah. Well, let me just join those words of Madam President. Thank you so much. Particularly thanks to the folks who's covering this, folks from the media. As you have heard, we have had this relationship with BARP for some time, and it is really, really a pleasure and a wonderful opportunity for us to continue this relationship. As you've heard, diabetes is actually the spread of diabetes in Barbados, or the prevalence of diabetes in Barbados, needs us to continue building these kind of relationships. So we are very appreciative of and proud of our relationship with BARP. We also want to thank the press for being here and for covering this, and to continue giving us their support in all the work that we planned, the 2 programs we have planned. And hopefully when we launch these programs, we get an opportunity, or we get the support of the press to help us take them island-wide. So again, thanks to everyone. Thanks for being here. Special thanks to BARP, all of the executive of BARP, so that we can continue working with them and spread the word about the services that we provide and the work that we are doing in controlling the impacts of diabetes across this Barbadian community. So again, thank you to all, and look forward for your continued support.
Ladies and gentlemen, thank you very much for joining us on this historic virtual signing of the agreement between the Barbados Diabetes Foundation and the Barbados Association of Retired Persons. Thank you very much, and we wish you a good morning. Thank you.
Thank you.
Thank you.
Thank you. Thank you.